Good morning, everybody. I would like to thank everyone for joining today. In a typical year, we would not be continuing our Tuesday 7 a.m. departmental meetings during the summer. It's clear, though, that there's a significant need and interest in moving together as a department through difficult conversations and realities that have been brought into focus with recent events. We started this departmental journey just 3 weeks ago when our own Pat Raines and Associate Dean Kevin Moody spoke so personally and profoundly about their thoughts, feelings, and experiences. We then heard from many of you about everyday events, stresses, and outrageous discrimination that few of us realized were occurring. Personally, I was shocked because I believed our department had no significant issues with diversity and inclusion and had made so much progress over the years. The town hall led by Dr. Pugh had many excellent suggestions on how we could improve as a department and as individuals. We are now in the process of designing a departmental cultural competency curriculum for everyone, regardless of job title. You have all received the goals and objectives that were attached to the announcement for this morning's session. Please review them and let us know if there is something that has been left out. We welcome input for session speakers and open forums. Please continue to send your ideas and feedback. As alluded to by Dr. Hahn, next week we're going to have upstander training. And in July, we're going to welcome Dr. Hannah Valentine from the NIH, a renowned expert who will speak on bias and its mitigation in biomedical sciences. We're actively contacting other presenters on a broad range of topics to cover these objectives, so there's more to come. The more of you that want to get involved, the better this process will be. This last week has been a dichotomy of news, more Black and brown deaths, and then the Supreme Court's historic decision that the 1964 Civil Rights Act protects gay, lesbian, and transgender employees from discrimination based on sex. This quote by Elie Wiesel expresses my own hope about these times. Quote, "I speak from experience that even in darkness, it is possible to create light and encourage compassion. There it is, I still believe in man in spite of man." So today's session topic is a direct result of the town hall discussion. There have been questions on how to elevate concerns of bias or inappropriate behavior. There are many concerns that make this difficult: hierarchy, fear of retribution or retaliation, confidentiality, and who to talk to. We've assembled 6 leaders from across the School of Medicine to discuss this today, and I'd like to thank them for getting up early to join us. And Julia, can you show the next slide? So I'd like to introduce them in order. So we have Jim Lafin, who is the Ombudsman. He'll be speaking first. We have then Susan Hoerger, who is our Deputy Director of Human Resources at the School of Medicine. Ellen Waxman, who is the Director of Faculty Relations from the Office of Academic Affairs. Our own Jim Korndorffer is our Vice Chair of Education, and our own Sheri Krams, who's the Associate Dean of Graduate Education and Postdoc Affairs. And then Larry Katznelson, who is the Dean of GME. So Jim, we'll have you address the department first. Thank you.
Yeah, thanks very much, Sheri, for giving me the opportunity to talk to your department. So I have been at Stanford for approximately 6 years. It's the first time I've been embedded in higher education. Before coming to Stanford, my background was that of a lawyer, practicing as a mediator for about the last 25 years, and taking a number of appointments up at UCSF before coming here to Stanford. So it's been quite a journey for me, just experiencing the culture that you all occupy. So the Ombuds Office, the most important thing for, I think, any of you to understand, and many of you I'm sure already do, is that this is a confidential resource open to faculty, students, staff, anyone with an affiliation with the School of Medicine. It is confidential, meaning I don't report to anyone who comes to see me or who I talk with. And I don't do anything without the permission of a visitor who comes to see me. And to give you an idea of the range of issues that come before me, I'm just going to read a few. Larry has heard me give a little bit of this talk before, and blessedly, I won't read all of the types of things that come to me. But this will give you an idea for the types of things that come through my office. Power struggles, jealousy, envy, favoritism, nepotism, neglect, disrespect, bullying, shaming, incivility, insincerity, discrimination on the basis of age, race, sex, gender, sexual identification, conscious bias, unconscious bias, sexual harassment and assault, research misconduct, defamation, intellectual property and authorship disputes, misunderstandings, unfair, erroneous performance evaluations. That's just a very few of a long list of sorts of things that come through the Ombuds office. So the question you might have is then what happens when people come to me, and that can take a variety of forms. My orientation is always to try to help resolve or sort out whatever the problems are by getting everyone who is involved to sit down with one another and try to talk through and come to an understanding of what the situation is, and hopefully figure out a better outcome than whatever the outcome is that exists when the visitor comes to see me. Sometimes that can, oftentimes that can be very effective, and it's a way to create obviously better understanding between the people who are involved, but also I think improve the culture of the department or the division that those individuals are functioning within. And if that doesn't work or seems to be inappropriate, then these issues can be escalated to division chiefs, department chairs, or to the school, to the dean's office. And that's something that is within the control of the visitor who comes to see me. As I said, I think earlier, I don't do anything without the permission of the visitor. So my office is a place where visitors maintain that control. I'm not a mandatory reporter, except for very unusual situations where I'm concerned that someone might pose an imminent risk of damage to themselves or others. But that sort of consideration aside, nothing is done without the mutual assent of the visitor and myself. I would add, I don't get involved in investigations or formal processes. Everything I do is of an informal nature. If a visitor wishes to engage the formal processes of grievance or appeal, I can give people guidance. I can tell them who they should connect with. I can help them connect with the various other resources of HR, Office of Academic Affairs, the Sexual Harassment Policy Office. All of those are resources which I routinely help connect people with. I would say, sort of as a bottom line, a lot of what I do is listen to people and try to be an effective thought partner with them so that they can understand what the issues are. Sometimes arrive at a clearer understanding of just what their situation is and what the institution can do to be of assistance. I wrote I think at the end of this, Sheri's going to send you a list of a more complete list of the sorts of things that I see that pass through my office. I also recently published an article about having difficult conversations, any conversations at all. And if any of you are interested, it's a very short article, and I would recommend it to you. The bottom line is that I think that our culture at every level could be helped a lot by people trying to listen better and just hanging in there. One of the things that I see over and over again, whether it's faculty, students, staff, postdocs who come to see me, is that they have a difficult time getting the hierarchy to listen. And I think that that's something that we can very effectively do a better job at. And it would help immensely with the sorts of cultural considerations that Sheri articulated so well. So
Jim, thank you so much. Let me just restate. So anybody in the department from any level of trainee, faculty, staff can visit you at your office and discuss concerns.
That's absolutely correct. Yes.
Yeah. And one of the things that came up on the question box is, and I'm not sure that you would be the person to address this, so if you're not, you can feel free to lateral it to somebody else, is where would you bring a concern if a patient is being abusive or discriminatory?
Well, that's an interesting question because I'm the Ombudsperson for the School of Medicine, which is really an inward-facing office. So my constituency is anyone with a School of Medicine affiliation. Patient care issues over at the hospital, that raises a range of issues. Technically, I don't get involved in patient care sorts of issues at the hospital. They have their processes over there. If it's something that really affects a faculty member or someone over within the school, then that's something I can get involved in and try to elevate it if the faculty member or other person with an affiliation wishes to do that. And that would be very fact specific as to how I would go about doing that. But yeah.
Okay, thank you.
I've actually reported that. I've reported that to patient relations, and I've had great partnership with those persons who staff that office and partnering with us on patients who have issues, because likely it will continue and it can escalate if you don't get a mediator or a neutral person involved. I try not to get my team members to take care of it, but patient relations is the one that helps us with patients who are discriminating against or being violent towards the physicians.
Thank you, Carla. So Jim, one question from Dr. Hahn. Can surgery residents, since they're technically hospital's employees, can they reach out to you in your role as ombudsman?
Yes, absolutely. And so I see residents from the various different departments on a regular basis. Yeah, and yeah, Larry and I have spoken at various points about this, and also with Ann Doan over there. So yeah, absolutely.
Okay. Thank you. So I'm going to ask you to stay on so we can field some questions at the end. Next, we're going to have a tag team of Ellen Waxman and Susan Hoerger, who are going to present from the School of Medicine side of HR and Academic Affairs. I'm not sure who's going first.
I'm going.
Ellen?
Sheri, yes.
Okay.
So Susan and I are the people who review most complaints that are brought about faculty and staff. I review complaints about faculty, and Susan and her team review complaints about staff, and sometimes we just work on them together. We've been asked to talk particularly about complaints, so what we're going to do is focus on situations that call for some level of review, although Susan and I are available just to be consultants for you. But what we're going to talk about today is some situations that require some action on our part. So what are the complaints that we receive about faculty and staff that we're most likely to hear involving racial and ethnic differences? Susan is going to talk first about microaggressions.
Let me take it away then. Their microaggression, when people hear the word, sometimes they think, well, it's something little that doesn't make a difference, and that's why it's called microaggression, but that's not the case. The case is it is small injuries or small actions that either by themselves or cumulatively cause people to believe that there may be a motivation that is either racial or ethnic or gender that is an improper, based on a protected class. And I can give you some examples that we've seen over the years. We've talked about doing one example and just working it through, but often it is not just one example. Someone comes forward because they have spending limits that others, their colleagues don't have, so they're held to a lower amount of money that they can spend on behalf of the School of Medicine. We had one case where an individual was unhappy and concerned that her colleague, who had control over the temperature for their two adjoining offices, kept selecting a temperature that made her physically uncomfortable. We had a case where someone felt that their desk, when they moved into the School of Medicine, had not been cleaned in the same way that a desk would be cleaned for a colleague. Of course, now every desk seems to be cleaned very, very scrupulously. There have been complaints about the frequency or content of meetings with supervisors, that they've been too frequent or not frequent enough, that they've been too skimming the surface or too detailed. Use of first names, where an individual feels that they use my first name, but colleagues who also are physicians get called doctor, or not being allowed to sign important papers like performance reviews, or not being able to communicate important information like pay increases, hours of work being scrutinized. So it gives you the flavor that each thing or one of these things may seem small, but to the individual who's bringing it forward, it seems pretty big. It seems as if it may have an improper motivation. What we in general do, if one of these comes forward, and it is always with the permission of the individual who's come forward, can I talk to the supervisor, the colleague, the manager, to find out why it is that these things are happening? Sometimes there's a completely legitimate explanation of what has happened, but it hasn't been well communicated to the individual who's distressed by the action. And in which case, as Jim mentioned, it's really important to foster communication between people. And is there a medium to do that? Is it that they can talk to each other? Is it that they need a mediated conversation either with the ombuds or with the health center or with someone from HR? And sometimes a supervisor, manager, colleague is completely unaware that what they did could have been perceived in a way that was unfavorable and unkind. And bringing it forward and making sure that people tend to look at their actions more closely in the future. Sometimes that is helpful, sometimes it works, not always. Sometimes the relationships have deteriorated very significantly by the time the issue is brought forward, so that it takes a lot of work to get them back on track where that's possible. Ellen, I turn it back to you for the secret complaints.
So another kind of complaint we get is what we call a secret complaint. So we have situations where someone comes forward with a complaint and they're willing to be identified because they know in order to bring the complaint, they have to be identified. But very frequently, someone has a complaint. Say somebody is in the workplace is making racially insensitive statements, and they want to do something about it, but they're afraid or reluctant for their identity to be known. What happens is that if we have more than one person who's making the same kind of complaint, we can look into that complaint without identifying who's brought it. What we'll do is we'll interview a wide swath of people in the department. Maybe we'll even interview former employees. But what we'll do is we'll tell everybody we're not going to share who we talked to or any specifics that you have to say that would identify you, but we will look for the general themes and we'll see if we can establish the concern that was brought forward in a way that we can generally bring it forward to the person complained about so that we can stop it. And so we want you to know that even if there are times where it is difficult to bring a secret complaint, there are some kinds of complaints where it's necessary for an individual to come forward, but just because you don't want to be identified doesn't mean your complaint can't be looked at. So we want to encourage people that they can come forward, and we will look in any way possible to protect people's confidentiality if we can. Another kind of complaint we'll get are on pay inequities. And for faculty, we have a whole process of doing a salary equity survey through our Office of Faculty Compensation. And they'll look at other faculty in similar positions. We actually have for faculty what we call a quintile analysis, where we look at people in various quintiles, and we expect that at certain seniority levels, they'll have elevated to certain range of pay. So it picks out the people who for some reason are anomalies. And in the past, we addressed those anomalies, particularly in ways of gender. But if you have a concern about pay inequity, we look at that. And I'll turn to Susan to talk about how we do that for staff.
On staff, with the regular salary program, in the years that we have a salary program, our compensation team at the School of Medicine is running the lists of different departments and where people are actually placed. That is somebody lagging the market by more than 10%, in which case we're looking at how can that be remedied and urging departments to look and remedy it in that year or have a plan to remedy it over the next several years. But there are other cases that we get where someone comes forward and says, my base pay is less than those of my colleagues who are a different race from me or a different ethnicity from me. We're looking to see, in that case, is that true? That is, looking at where the individual falls vis-a-vis peers and colleagues in the same job classification with the same tenure of employment. Often it is the case that someone came in at a different time, so the market was different when they entered the workforce, and there is a reason to try to make a correction, to urge a department to make a correction. People also make complaints, my raise wasn't fair, I didn't get the raise that my colleagues get, or I didn't get the bonus that my colleagues get. And there, what we are looking at is it true that people with the same performance rating, because there is, for staff, annual increases are tied to performance rating within, not letter perfect, but within a range. So is it in kilter or out of kilter? Bonuses, are criteria met? So departments are looking at merit bonuses. How is the performance? In general, these complaints, when they come forward, we can't say, well, you get this pay and so gets that pay. But people are often assured, once we have taken a look, if we are able to say that the review of the pay shows that it is within the right confines, or it's reasonable given the performance, given the whole market. And also, if it is necessary to make a correction, we urge the department. It's the department, not the HRG compensation group, that would make the correction, but we do make that urging. And usually the advice is taken. Ellen,
all right.
I'm going to go.
Let's talk
should I talk briefly?
Retaliation. One of the biggest barriers to people bringing complaints is that they're worried about retaliation. And we do everything we can to try to help people bring their complaints forward. As I talked about, one of the things we'll do is try to work with people's ideas of confidentiality in order to help them bring it forward. We tell everybody who's accused of doing something wrong not to talk about it in the workplace, and not to talk to anybody about the issue at all, because no matter what the conversation is, it'll be perceived as retaliatory. We tell everyone who brings a complaint that we're available if anything happens to deal with retaliation, and we take complaints of retaliation very seriously. We investigate them, and I can tell you that complaints of retaliation, the penalties, the sanctions are usually more serious for retaliation than they are for whatever the original action was. So we really try to let the person know also that if you've been accused of something, if somebody has made a complaint about you, don't take any actions against people without consulting with us. Don't move somebody's office. Don't change their job description. Don't do anything that could be perceived as retaliatory without consulting with us, so that we can prevent any action that could be considered as retaliatory. Susan's now going to talk about the kind of remedies we can impose. I'll talk about faculty. Susan will talk about staff, and then we'll talk about what you get to know as the complainant.
On the range of penalties, if we have an investigation and the finding is that there was inappropriate or wrong action on the part of the person who's accused, there is a range of things that can happen. There can be training of that person. There can be counseling. There can be a letter of expectations. There can be oral or written warnings. There can be a final, we call it, last clear chance agreement. This is the only warning you're going to get. Nothing like this can ever happen again. There can be economic penalties, a suspension without pay. There could be a pay reduction. In a very worst case scenario for the person who has been found to have committed something wrong, there can be a separation of employment. They can be terminated. We look for a remedy that matches what the actions and the findings were. It's not, I just described it as if it's progressive, but it is not progressive. It is finding the remedy that is most effective and most merited by the circumstances.
For faculty, again, we tailor the remedy to what the problem was, but we can freeze pay, we can take away bonuses, we can change faculty duties, we can take away faculty's clinical duties, we can monitor them in their clinical practice, we can take away leadership positions, we can prevent the faculty from having an endowed chair, and in some situations that have resulted in separation from the university.
Looking at what the complainant knows, in many cases we're not able to tell the complainant what happened to the person who was complained about, because it is a personnel action. It's not very satisfying that we have to say we have taken appropriate action. In some cases, though, part of the appropriate action is the person who was complained against has to agree that the penalty is made known to the person who complained. Now and then there is an apology that either is the person who had engaged in the wrong conduct wants to apologize, and the person who received the conduct is willing to have that apology. Sometimes they're not willing in the least to have that apology. But where they are, that can be part of the remedy. And part of the remedy can be, we're going to have X happen to this person, and they have agreed that you can know that X is what's going to happen.
Thank you.
I want to just,
Sheri.
Great. Can you guys hear me? I'm having phone problems. Can you still hear me?
Yes.
Okay,
Yes.
great. So thank you so much. And what we'll do is we'll hold some questions to the end. What I'd like to do now is move to some of our trainee sides and have Sheri Krams talk about this from postdoc and graduate students.
Okay. Yeah. Okay. I had some slides that I sent you. Yeah. Okay. So there we are. So I'm going to tell you a little bit about the resources that are available to postdoctoral fellows and graduate students, as well as to the people who mentor the graduate students and postdoctoral fellows. And I want to start by reading a little bit from a letter that was sent to the president and provost entitled Action Items for Achieving Racial Equity, that was published in the Stanford Daily actually on Juneteenth, last Friday. The letter begins, "We, the Black student and postdoc community members in the Stanford University School of Medicine, are scared. We are exhausted. We don't feel safe on campus or in our communities. We have waited far too long for action." And this letter, which is very difficult to read, really should be read by everyone who has interactions with postdocs or graduate students. And this letter was actually co-signed by 25 student groups throughout the university, including many in the School of Medicine. And if I could have the next slide, please. I just want to go over who are the graduate students and postdocs in our community, because it is a very, very large community. It consists of over 2,700 trainees. And here, taken from the Ideal dashboard, we could see that in the among the graduate students, which is the top line, we actually, when we look at the number of men and women, we can see we actually are now training more women graduate students among all of our programs in the School of Medicine. These are our School of Medicine numbers. 54% of the 1,253 graduate students who are currently at the School of Medicine in this past year. And of those members, 20% of them are actually underrepresented minorities, including 4% of Black trainees and 10% international students. In the postdoc community, it is even larger than the graduate student community at just under 1,500 trainees. And here we are basically at 48% women, 52% men. That has definitely increased over the past few years. But we see, as far as underrepresented minorities, it is quite a bit smaller at 6%, 2% Black trainees, and 58% of the students are actually international. So there is a large community here of graduate students and postdoctoral fellows. And what I'm going to tell you about for the rest of my time is how we can better support our Black students and postdocs and the resources that are available. And in the next slide, I realize it's very busy and I'm happy to provide these resources to people. I list some of the major resources that are available to the students, the trainees themselves, or their mentors. So the first resource is the Office of Graduate Education, and that's really the go-to place for anybody, anything graduate student, and that's headed by Adele Thomas and her team. And they, in addition to being a great resource in response to all the racial crises of the past month, they've assembled an excellent guide that provides a lot of resources for advisors and faculty and staff and people who are around our our Black graduate students and postdoctoral fellows, the resources that would be very helpful to educate yourselves, engage with the community, take financial action, and hear the voices of our trainees and provide support in the labs. And really what it comes down to when you read through these resources, and it's about 6 pages of resources, and it's actually a Google document because it is changes as new resources become available. It is really something, and the message here is that if you really, really care about your trainees, what you need to do is talk to them, listen to them, and really, really hear what they need and want. And I urge all of you to take a look at some of these things in this really very, very helpful guide. In addition, the Office of Graduate Education is available for all students to come to with any concerns that they have about any bias that they feel or anything they feel within their labs or within the community. And it's also a resource for their mentors to go and to get clarification of things that they may need. There's also, in recent years, there is a new place in the Lane Library, very close to the Tech Bar, called the D-Corps. And if you've been down to the Tech Bar, you may have noticed it. The D-Corps stands for the Diversity Center of Representation and Empowerment. And what this place actually is a space where any member of the Stanford medicine community interested in issues of inclusion and diversity can hold meetings, hang out and study. There's also a staff of the D-Corps, and there's usually some of these staff have office hours regularly throughout the week. Before COVID, it was held in the D-Corps, but now some of the personnel actually do have Zoom office hours, and they're available for the trainees as well as people who want to talk about interactions between their students or any clarification or help that they may need. Just like there is a specific office for the graduate students, there is a specific office for postdoctoral fellows. It's called the Office of Postdoctoral Fellows, and Sophie Klepner is the Associate Dean who is in charge of this place, where she has many, many resources available for postdoctoral fellows, and definitely appointments where she will talk to postdoctoral fellows about any of issues they may have, as well as their advisors and mentors. She's especially very good about any conflict, about mediating conflict resolution between trainees and their advisors. And of course, I am available for any postdocs and graduate students who feel that they have any concerns about issues of bias or how they're treated or anything like that, that they feel they want to talk to someone about. There's other people also in the Dean's office. Will Talbot's the Senior Associate Dean for Graduate Education and Postdoctoral Affairs, as well as David Schneider. He is the advising dean for Graduate Education and Postdoctoral Affairs, and he has a Google Doc, which you could find at the website, where you could make appointments with him to talk about any issues relevant to graduate students and postdocs. And he has been, of course, seeing many people with both COVID as well as all the things going on in the past months or so. But of course, our graduate students and postdocs do spend most of their time in their labs. Thus, all of us as mentors must advocate for our trainees. Clearly, there is much more work to be done so that every one of our students and trainees can see themselves reflected in the faculty that teach and mentor them. Thank you very much.
Thank you very much for that. And what I'd like to do is sort of continue in the theme for the trainees. We've heard about faculty and staff and sort of everyone now. And I'm first going to have Jim Korndorffer sort of talk about it from our department side, and then we're going to finish with Larry Katznelson, who's going to really talk about it from the university side. So Jim?
Thank you, Dr. Wren. certainly, as Dr. Wren mentioned, we're going to focus really on the departmental aspect, not GME as a whole, and really talk about our trainees, and our trainees being whether those are students, residents, or fellows. And Julie, if you could put up my slide, that'd be great. Nothing here really that I'm going to talk about is really anything new that you're not aware of that exists, right? But I hope by the next few minutes, the trainees will think of this, and we've talked to all of the program directors as well, that maybe you're going to think of this in a different way. And one of the things that came up in one of our town halls was the concern that people had that if they brought these ideas or problems up, that they were going to be seen as a complainer. You know, it's kind of interesting. At first, I didn't really understand that. But then actually listening today, even, what we talk about is raising complaints. So by definition, it is actually being a complainer. But I want you to think of it as a different way. So don't think about it as raising a complaint, but think about it as bringing up information or bringing information to people that can actually make a difference for you. But also without that information, we all can't make a difference for the department, which is really what this whole curriculum is all about. So hopefully by the end of this, you're going to think of it differently as not, again, not as bringing up any kind of complaint, but truly bringing information forward so we can make that effective difference. Because without that information, we won't be able to do that. And how can you do that? You know, certainly everybody's aware of the written aspects where you can use the MedHub, whether that be end of rotation evaluation, faculty, et cetera. And then of course the residents also have the anonymous Qualtrics system that they can use. These can be as specific or as general as possible, as needed, I should say. And do understand that these are all taken very seriously and looked at carefully and evaluated. Additional to that, you know, there's several options you have from a verbal standpoint. And I really do understand the concern, not necessarily from the bringing the information forward, but the concern that the anonymity that this occurred, that this causes, or the lack thereof. But I assure you, having talked to all the program directors, they all want to know the information that you have if it is something they need to try and make, again, the department or that program better. Another resource you can certainly use is your program coordinators. And that certainly is another opportunity you can have. If you want a little bit of a degree of separation, I'm here and available. I've actually used this in some of the fellowships, particularly those that just have one or two fellows. It's very difficult to bring these things forward directly to your immediate fellowship director because of such limited interactions. But that's another area where I can actually be put in place for that. Another one that came up, which actually the program directors brought up, is if you really want even further separation, is any and all of the program directors would be more than happy to hear your concerns and information with what you're dealing with. For example, if you're in general surgery and you want to speak to someone about this at the program director level, then by all means, you could go to the program director in plastics or vascular. Similarly, the flip side could occur as well. So all of these are opportunities where you can bring your information forward so we can actually make that effective difference. Now, I do want to bring one caveat up. As it was mentioned by the Ombudsman, that he is not a mandatory reporter. We, however, are, but understand that. That's if something very specific comes up. If it's more general, then certainly that is not the case. But yes, you're absolutely right. If in certain instances, if you come to us and state that you have been the victim of sexual harassment by X, an individual, or racial discrimination by X, then yes, if that rises to that particular level, we would have to directly report that. But again, remember, it's all up to you as to what you're describing. But without that information to begin with, it's going to make it a real challenge for us to continue to make the difference that we all want to make. And so I certainly encourage you to not think of this as being complaining, but truly do think of this as moving that information forward to us. And then Dr. Katznelson, I believe, will discuss it specifically from the GME standpoint.
Thank you very much. So now we're going to go to the GME standpoint and the school, I think, representing what's going on in the school.
Thank you, Sheri.
Yeah, there we go. Yeah.
Thank you, Sheri. Welcome everybody, and I want to thank Sheri and Jim and the rest of the department for putting this together in the first place and inviting me here this morning. I also just want to take a quick opportunity to congratulate the residents who have finished this year and or their training, and to welcome all the new house staff to Stanford. Welcome here. There are a number of things which have led to this meeting today. There, as you are all aware, of the recent events demonstrating assault on and response by the Black community. And as was alluded to earlier, the Stanford Daily Report about sexual discrimination and harassment here at Stanford. We definitely need to do better, and we're all working towards that direction, but we are clearly not there yet. Next slide. Now, there are some basic truths that I'm just including on the slide, and just get a sense of the scope of GME. We have 1,400 residents and fellows. About 51% are women. We have over 170 programs here at Stanford. So the scope is large, but we need to be able to address bias in all of our trainees here. We know that bias in the workplace is prevalent, both conscious and unconscious. We really do not have a handle on the prevalence, at least at Stanford. That's something, as I'll tell you in a few minutes, we're trying to work on. And our goal, of course, is to maintain and create a work environment that is free from bias. We want our trainees to be working in an environment where they feel safe and they were able to focus their energies on their training itself. We need much better ways of educating on bias, from standard to more innovative ways, and I'll describe at least one of these innovative ways in a minute. There is one program that many of the residents may know about that is called the LEAD program, the Leadership Education Advancing Diversity Program. This comes out of the Department of Pediatrics, and this has been a big win here at the medical centers. LEAD just won a major Stanford Diversity Award. It is a faculty mentored program of residents and fellows across the institution who work together to address kind of diversity and inclusion issues. And if you'd like more information, I'd be happy to get this to you, but it has been a big success story here at Stanford. Another point is that bias should be reported, but as Jim Korndorffer said, there are limited mechanisms to do so, and those mechanisms that are available are poorly utilized. Next slide, please. So how can we report? And I'm going to start off by saying that these mechanisms are insufficiently utilized. The residents have semi-annual program evaluations. These go directly to MedHub. These do often include evidence of misconduct in the training programs, but usually it's not reported here out of fear of retaliation, as was said by multiple speakers earlier. We know this. We know we have this reporting system, but we know that it is faulty, and we're sure the numbers of actual events exceed what is reported on these evaluations. There's a GME hotline, which generally is not utilized. This is a hotline that goes directly to Ann Doan's office. It's anonymous. There are usually 1 or 2 calls a month, but generally not on this topic. Rarely they have been. There is reporting up the chain to the program director, to the DIO. People can call me, but usually by the time people call me, there have been a number of people, usually program directors, who have been involved in the first place. They could be reporting directly to HR. But my understanding of these reporting systems is that once HR is called, an investigation can be delayed and take a long time. And there's a lot of frustration about that, about kind of the rapidity with which the work ensues. Jim Lafin, who spoke earlier, is another terrific resource. We have worked together on cases where residents have been referred directly to Jim in order to bypass some of these the org chart of reporting systems. And so the Jim is another great resource. Next slide, please. So I just want to discuss a little bit about what can be done and what are some options. We know we are here at the school and the hospitals committed to safeguarding our trainees, faculty, and staff. And the question about how to report bias has been the issue we're trying to tackle. I think Jim Korndorffer brought up a really interesting, important point about having an opportunity for residents and fellows, particularly fellows, because they usually have very small program size, of reporting to other program directors. In fact, years ago when I was a fellowship program director in the Department of Medicine, and at the time, Linda Boxer, who's now our Vice Dean of Medical School, she was fellowship director for hematology fellowship program. We came up with the idea of having routine meetings between fellowships, one program with program directors from another, which actually did lead to very small town halls that led to kind of novel changes, innovative approaches to those programs, and allowed residents and fellows to feel a little more open and less vulnerable in presenting their concerns. At the School of Medicine, there is a lot of discussion at this time, particularly in the wake of recent events, on ways of improving reporting systems. We are looking for ways to allow for, is lack of a better way of saying it, kind of online active reporting where people can feel safe to report events as they occur. This actually is now in the thinking process, and we'll hopefully have something to roll out in the months to come. But we are dedicated to finding a better way of approaching the system. For example, if we come up with an intervention, a new education tool, how will we know it's successful? One metric would be complaints and evidence of bias in the workplace. So we do need to look for better ways of reporting, and that is an ongoing discussion now. We need to enhance education tools. The example is we're working now on a virtual reality model, looking at ways of immersing someone in the environment to see what someone else is seeing through their eyes. That is being developed now as well, trying to come up with new approaches to teaching about bias to make everybody aware of what others are experiencing. I'm going to tell you about a few, I'm going to finish here, but just a few of the tools that we have in terms of community at the hospitals. There is a GME diversity committee, which was actually started by a surgery resident, Mikhail Miller, who I'm not sure if Mikhail's on this call. Mikhail started this. She was a medical student here at Stanford, was very active in diversity and inclusion when she was a medical student, and with help from my office and diversity office, created the GME diversity committee, which has been instrumental in helping improve our recruitment of diverse residents, as well as forming community and connection with role models and mentors here. Our goal is to create a pipeline of future leaders with diverse backgrounds. And to do this, though, we need to create an environment here at the residency level to enhance that. There's a Women in Medicine Committee, which was started by a few faculty and myself about 3-4 years ago now, which is trying to create support and education for women residents here at Stanford. This is both community and scholarly. One of the educational programs this year has been on looking at fertility and family planning for women residents, which is an important issue for women who are in their 20s or 30s. SMAC is the disabilities program, which I won't speak much more about now, but that's part of our support here in GME, as well as LGBTQ committee here, which is all part of the diversity. And we're working all together here to try to look at ways of enhancing our environment. And there are representatives from each of these programs who are helping us start thinking about reporting on bias as well. In the interest of time, I'm going to stop there, but thank you again for including me.
Thank you guys very much.